Hi there. Our next topic is going to be shortwave diathermy, and we follow this after ultrasound because you'll see there is a lot of overlap or a lot of similarities between these two modalities. So shortwave diathermy, if you've never heard of it, and don't worry because it's not super common, so you may not have heard of it. It is a type of modality that uses high-frequency electromagnetic energy to produce deep heat. So it's very similar in ultrasound as far as the depth of penetration of heat that it can produce. The electromagnetic energy is similar to radio waves, so the FCC has reserved 3 frequencies specifically for medical use. Again, the thermal effects are going to be similar to the other types of thermotherapy that we've talked about before, but we are going to be able to get to deeper tissue with diathermy. So diathermy and ultrasound are considered to be the deeper heating agents that we have talked about. Also, like ultrasound, diathermy can be set up to do thermal treatments or non-thermal treatments. Some benefits of diathermy are that it does not reflect from bone, and so therefore it's less likely to cause hot spots. Another benefit of diathermy is that it's able to treat a greater volume of tissue as compared to ultrasound. So we're able to treat larger areas with diathermy than we could ever do with a single ultrasound. So some of the reasons that we don't see diathermy as much anymore, the older machines, the energy scattered from the intended treatment site. So there were some questions about how safe is this to expose our patients, and probably even more importantly, how safe is this to expose our clinicians to, because they would be exposed multiple times throughout the day. There was also some interference between computers and cell phones, which were getting more and more popular and are absolutely everywhere today. So because of that, we started to see less and less use of diathermy. However, it is starting to make a little bit of a comeback, and improvements have been made in all of these areas. So it doesn't interfere anymore, and it is much safer now than it used to be. So there's 2 major types of diathermy. If you ever see diathermy, it will be the induction field type of diathermy that you see. This is going to place the patient within the electromagnetic field, and it's going to get the greatest amount of heat down to the muscular layer. It isn't tissue specific, but it is considered to be the safer form of the 2 types of diathermy. The other type is a capacitive field generator. It uses the patient's tissues as the actual part of the circuit. It is going to heat adipose and bone a little bit more, so it is not considered to be quite as safe. It's dependent on tissue constitution, so it isn't recommended for patients who have really thick adipose. With capacitive field, it actually doesn't penetrate quite as deep, so it is going to heat the skin and the adipose a little bit more than it would the muscle and the layers below, which again is usually our target tissue with treatment. So with induction field diathermy, it uses a high frequency alternating current that flows through a coiled cable. The most common method is a diathermy drum, and the inside is going to look kind of like the coil on a stove top, so an electric stove. So that's what that looks like. You can also just have sort of like a coil that you can place around a patient, and we'll talk about that as we get a little further through. Again, with the induction field, the patient's tissues are placed within the electromagnetic field, but they're not actually part of the circuit. The cable method, again, you can also use a conducting cable that's wrapped around an extremity, or you can coil it up and place it in a towel or pillowcase and then directly on the patient. Again, this isn't used very often. It's complex to set up, and there is a potential for burns because of uneven placements and things like that. So again, the most common method that you're going to see is this drum method. So this is an older version, but this is fairly similar to what it looks like today, this inside piece. So it's a cable coiled within a plastic drum. So this is the cable, again, looks a little bit like the electric stove top. The drum is then positioned directly over the target tissues, and the electromagnetic field is going to arise perpendicular from the cable and then travel straight down into the tissues from that. Ions are going to oscillate. They produce currents. This produces friction, which then produces heat. The amount of heat is going to depend on the strength of the electromagnetic frequency and the distance between the tissues and the source. So you can see in this picture, the drum is placed pretty close to the patient. It's almost directly right in contact with the patient. There is a layer there, so there's like a thin gown there that the patient's wearing. We do usually put like a towel or pillowcase or something to serve as a protective barrier. This is capacitive field diathermy. It looks a little bit more like e-stim, where the patient's tissues are placed between these two plates, basically. They're placed on either side of the site that's being treated, and then an alternating current is applied. The plates will have opposite charges, which creates an electrical force between them, and it's going to heat the body on both sides. The current is going to flow along the path of least resistance, which also makes it like e-stim, which we haven't gotten to yet, but we will. Again, with capacitive field, there's going to be more heat in the superficial tissue and less in the deep tissue. So again, the skin, the adipose are going to be heated to a greater extent. With this, again, adipose is going to be a poor conductor, so it is going to insulate the underlying tissue, and we'll heat that more than we will the muscle underneath. The strength of the EMF is going to be closest to the plates and weakest in the middle. The dipole effect is essentially how diathermy works. A dipole right here is a molecule with no net charge but has oppositely charged ends. So picture in your head like a battery that has a positive and a negative end. So this molecule has both a positive and a negative charge, but they cancel each other out, so there's no net electrical charge. And then when it's exposed to electromagnetic frequency, it starts to rotate and spin. So this is what actually produces the heat for diathermy. Capacitive diathermy, again, this is not the common one. This is the one you will probably not see. It uses air space plate electrodes, which actually contain a coil within those plates or within the electrodes. They need to be placed evenly on opposite sides of the body part because uneven placement will lead to uneven heating, which can then increase the risk for burns. So again, this is not considered the safer version. This is not the one you will most likely see. Like ultrasound, again, diathermy can be applied continuously, which will increase tissue temperature and cause thermal changes. Pulsed, again, is not completely non-thermal, but if you set a low enough pulse rate, you can minimize the thermal effects. So this is good for acute and subacute conditions. Again, the heating is going to depend on the on-off ratio. So again, the lower the ratio, the less amount of heat you're going to have. Pulsed shortwave diathermy, again, we typically use a low intensity with that as well. It uses a short pulse duration and a low duty cycle. Again, heat will be generated, but the idea is that blood from the area will cool that down quick enough that we're not going to have a significant increase in tissue temperature. Don't worry too much about any specifics there. But again, remember, energy is not going to be reflected from bone, so no standing waves will be created. So in that regard, diathermy is a little bit safer. The non-thermal effects are similar to the non-thermal effects of ultrasound. It uses a low number of pulses, a short pulse duration, and low intensity. Again, this is good in the acute stage and for post-surgical treatments. The idea behind this is that we're going to increase vascular perfusion, increase macrophage activity, decrease edema, just overall sort of speed along that acute inflammatory process and get the person to proliferation a little bit sooner. Thermal effects, again, same thermal effects that we've been talking about. The advantage of diathermy, again, is that it can heat a larger volume of tissue. The heat is also retained longer, about 3 times longer than with ultrasound. It is going to be less effective on people that have large amounts of adipose. So again, someone with a lot of adipose, ultrasound is going to be one of the safer ways to go with them because ultrasound does travel pretty easily through adipose tissue. The inductive drum method, again, this is a newer version, and if you see it, it's going to be something similar to this. It is the most common form marketed. It's going to heat muscles and blood vessels. It does heat an area approximately equal to the size of its face. So you can see these are much larger plates here, so they're going to be able to heat a much larger area. Peak temperature increase is about 15 minutes into treatment. Most diathermy treatments that I have seen usually last somewhere in the ballpark of 15 to 20 minutes. So pretty much on par with thermal modalities that we've talked about. Similar to ultrasound, we're going to have more heat in the center of the drum and less as we get out towards the periphery. Back to the capacitive method again for just a second. Again, that's going to heat skin and adipose a little bit more. You will get a little bit of heat down in the muscle just because it diffuses down towards that area. And the heating is comparative to ultrasound. As far as the effects on inflammation, non-thermal effects are going to change the rate of diffusion across cell membranes, so it's going to alter cell membrane permeability, help to increase the removal of debris. Thermal effects are going to have all the same thermal effects that we've already discussed, including increasing cellular metabolism, increasing blood flow, and with increased blood flow, you'll have an increased concentration of white blood cells to the area, which can help with healing. The effects on blood and fluid dynamics, again, as with all thermal modalities, heat's going to produce vasodilation, increase in blood flow, increase in capillary filtration. It can also help with increasing collagen deposition, which again, speeding along that proliferation stage to speed along healing. And diathermy can also be pretty useful in resolution of hematoma. Hematoma is a very deep bruise. So with diathermy, being able to get down into deeper tissues and increase blood flow to those areas, it can help to get that hematoma to go away a bit faster. Effects on tissue elasticity, again, we can get to vigorous heating levels deeper than 2 centimeters. 2 centimeters are our more superficial heating agents, hot packs and whirlpools and paraffin. And the heat is going to be retained for longer periods. So we talked about those post-treatment stretching time windows with ultrasound. It was a couple of minutes, again, depending on frequency a little bit. With diathermy, because we're heating a larger area, you probably have a little bit longer to stretch the tissue afterwards. And again, we're always going to need repeated sessions of heat and stretching to actually improve range of motion. They have looked at diathermy and used it on wound healing. If you're going to see diathermy, most places where you'll see it are going to be skilled nursing facilities, which is also one of the places we tend to see wounds. And so we can use diathermy to help treat wounds as well. We're going to use pulsed typically most of the time. So just like in the studies that were cited with ultrasound, they typically used pulsed ultrasound to treat those wounds. We will typically use pulsed diathermy to treat wounds as well. It helps to increase white blood cell concentration, which will help with healing. And it also, they found decreased need for pain medication in patients who received diathermy for wound healing versus just traditional wound healing techniques. Superficial open wounds shouldn't be treated because there is some moisture that's produced with diathermy, so similar to sort of moist heat. Contraindications for diathermy, if they have acute inflammation and hemorrhage, you're not going to use thermal diathermy at that time. If they have any metal within the output field, and that can be clothing or jewelry, so like any external metals, zippers, snaps, buttons, anything like that, you want to make sure that they are removed and not in the area in which you're treating. And joint replacements we need to use some caution with. Joint replacements are typically deep within the joint, and we're probably not going to be able to get to them with diathermy. The other thing is most joint replacements are made with types of metal alloys that are not going to respond to heat too well, and I do know that patients who have had joint replacements have had diathermy, but we do want to be cautious with that. Pacemakers are absolute contraindications. Moist dressing, lotion, adhesive tape, again, because there is some moisture created with the application of diathermy. This would be more of a precaution, really. We never want a diathermy over the area of the head. Again, we're talking like fluid-filled cavities. Pregnancy, again, makes this list, as it will most. And then this one deserves mentioning too, overgrowth plates. This one wasn't on your ultrasound contraindication list, but when I was in school in my textbooks, it was mentioned for ultrasound as well. And because these modalities are so similar, you do absolutely want to use caution over growth plates. So growth plates, again, present until we're done growing, 18 to 25-ish, they say now. We typically don't want to ultrasound or use diathermy over open growth plates. Again, just because we don't want it to interfere with anything and potentially slow down the growth in those areas or make it uneven or anything like that. So you're going to see that probably mentioned with ultrasound as well. So we typically don't do ultrasound or diathermy with kids all that often. Controversies in treatment. There's really not a lot of research out there about diathermy. Diathermy was starting to go away before there was this big push on research. Now that it is starting to come back a little bit, you will probably see a little bit more research out there. Some of the published studies don't have randomized control trials, and there's other flaws with the studies as well. Also, some of the controversies center around those potential hazards with repeated exposure to electromagnetic frequencies, especially for the clinicians who are, again, going to be exposed potentially multiple times throughout the day. Again, with the newer models that we're using now, they have made a lot of improvements to increase safety for both the clinician and the patient. All right, so there's diathermy for you.